Welcome. I am Mara Briere, Certified Family Life Educator, founder and president of Grow a Strong Family, an organization which is devoted to providing support to families uprooted by mental illness. Today's presentation is called Guilt and Responsibility, something that family members often feel, and we decided it was important to address it. So let's get going. First, I just need to let you know that this presentation is funded by a grant, a local grant from Shana, which is a collaboration from Leahy Hospital and Medical Center and the Winchester Hospital, and that there will also be a televised presentation by Bedford TV, our partner. In this webinar, we are going to be discussing about guilt and its impact on the family, in particular the caregiver, and who is responsible for what. What is it that you as a caregiver or as a family member is responsible for, and what is it that you're not responsible for? And strategies for managing when guilt and responsibility undermine the family and your effectiveness. What is guilt anyway? Well, I had to look it up because even though we all know what it is because we all feel it at times, I thought it was important to be able to recognize what it is and have an agreed upon definition. So according to the Merriam-Webster Dictionary, guilt is the state of one who has committed offense, especially consciously. So if you know you're doing something harmful, if you know you're doing something wrong, we do experience guilt, and that probably is a positive thing because it will motivate us to examine our behavior and do something different. Guilt is also feelings of deserving blame, especially for imagined offenses, or from a sense of inadequacy, a sense of self-reproach. This is more often what I find that caregivers feel. We feel as though we're responsible or we're to blame for things that especially our loved ones may accuse us of, even if we don't necessarily agree with them. We question, is it possible? Do they have a perspective that I should be paying attention to? Does this make sense? What causes guilt? According to Whitburn, there are 5 causes of guilt. Guilt for something you did, which we have already discussed. Guilt for something you didn't do but want to. You really want to go to some of the appointments with your loved one, participate more in treatment, but you don't really have the time because you have to work or you have other family members that you're taking care of or you have other commitments. Guilt for something you think you did. Maybe I caused this. Maybe this is all my fault. Maybe it's I was too hard or too soft or didn't pay enough attention or didn't provide the kind of safety or security that my loved one needed. So that's guilt for something you may have think that you did. Guilt that you didn't do enough to help someone, and guilt that you're doing better than someone else. This doesn't usually apply to family members who are caretakers, but it could apply, oftentimes does apply to siblings, where one sibling feels responsible for another sibling because they're doing so much better than their sibling is doing. And it can cause a sense of responsibility and a sense of guilt. For the guilt for something you think you did or guilt that you didn't do enough to help someone, I had an example recently where a woman was telling me that her daughter, when she was 3.5 years old, got bit by a dog. And the daughter, who is now in her mid to late 30s, is complaining that she didn't do enough to take care of her daughter when she was 3.5 and bit by the dog because she was out of the country. So I said to the mom, who was taking care of your daughter at the time? And she said, well, my parents. And if anything had happened to you and your husband while you were out of the country, who would have been responsible for your daughter moving forward? My parents. What kind of relationship did your daughter have with your parents? Oh, they adored each other. They were all so very close. So why are you feeling guilty that you didn't do enough to protect your child, that you weren't there to keep her safe, that you could have prevented the dog bite? And she said, well, when you frame it like that, it's kind of silly for me to feel guilty for that because I had her with people who loved her dearly, knew how to keep her safe, and Sometimes things just happen. So I said, yeah, but that's an example of guilt for something you think you did. What is caregiver guilt? This is what happens oftentimes when we are taking care of individuals who have a chronic illness. And mental illness is a chronic illness. We can feel ambivalent, anger, anxiety. We can feel irritable, sometimes feel a sense of depression or sadness or loss. We can feel disgusted, especially if there are physical tasks that we have to do, cleaning up after them. I know that it was horrible for me when I had to clean up after a loved one cut herself and I had to clear out the blood. I know that other people have had cases of incontinence or they've had to bathe their loved ones. And there's embarrassment. Sometimes we feel guilty because we're afraid or we're frustrated or we're grieving and they're still alive, but they feel so lost to us. Sometimes we feel guilty because we're impatient. We don't appreciate how far they've come or what they do still have going for them or how well they're managing with what they have to deal with. Sometimes we feel guilty because we're lonely, because we feel more isolated, because we're tired. We don't want to keep doing this. This, by the way, is all part and parcel of what any caregiver feels when caring for anybody with any chronic illness, not only with people who have a mental illness or a brain disorder. What thoughts come to your mind when you are feeling guilty? For this, we have a handout on our webpage, and it's called Guilt and Responsibility, and it's the If Only exercise. And examples of if only I had not spoiled him, if only I had seen the signs earlier, if only I had been a better parent, if only his doctor had been smarter, if only he hadn't gotten into drinking, if only, if only, if only. What thoughts come to mind when you are feeling guilty? And they typically are the if onlys. Well, you know what? We can't really do anything about the if onlys, but it's a good idea to look at those and to bring them to the surface so that you can see how you don't have that kind of control. And because you don't have that kind of control to be thinking about the if onlys, you know, you didn't cause it, you can't cure it, you didn't create it, you can't control it. It's an illness. Sometimes illness just happens, especially when it comes to chronic illnesses like mental illness, like heart disease, like diabetes, like autoimmune disorders like rheumatoid arthritis or lupus or ALS. I mean, stuff happens. What are some strategies for easing the guilt? Get rid of the should, must, and have to. Get rid of the oughts. They're not helpful to you, and they're not helpful to anybody around you. Other strategies, admit that you are powerless over other people and that your life has become unmanageable. And for this, I've included a completion exercise that I ask people to fill out. Again, we have the handout on our website. And it's things like, when I admit I am powerless over people, I realize I didn't cause this, I can't control it, I can't fix it, I can't make it better. Something that causes me to feel powerless is when my loved one is psychotic, when my loved one is not willing to get out of bed, is not able to take his or her medication. My life is unmanageable when I keep the focus on other people, places, and things that I have no control over. These are examples of how to do the fill-in exercise. When I admit my life is unmanageable, I am sad. I am relieved because if I admit my life is unmanageable, I'm beginning to realize that I have control over some things. What are those things? It is important for me to admit that my life is unmanageable because it helps me determine what do I have control over, what don't I have control over, what can I do, what do I need to let go of, what are the parameters of my experience and somebody else's experience. So the sentence completion exercise tends to be a very helpful resource for people because it kind of gives us a perspective back that we may be losing when we feel guilty. Remember, I have no control over other people, places, or things. I cannot control when others are hungry or tired. I cannot control what others think about anything. This is what powerless means to me. Very similar to when when children are toddlers, one of the things that parents realize right away is, I can't control what comes out of their mouths. And we kind of have to remember this at all times about other people. Most of us want the very best for those we love, and the best we can offer may be our refusal to contribute to their path of destruction. We cannot make choices for other people, even for those most important to us. We are not gods, and we can't truly know what is best for anyone else, no matter how obvious a particular course of action may seem to us at the time. This is from Al-Anon Works. One of the parenting programs that I teach, the Parenting the Love and Logic Way, we talk a lot about problem solving. And one of the things that we always say is the person who is in the best position to solve a problem is the person who has the problem. And if a person is not healthy enough to engage in problem solving, that doesn't mean that we still can't engage in an activity to kind of support them in getting some further clarity or a sense of control so we can move them from a place of immobility to mobility, from inaction to action, from maybe distorted thinking into managing more effectively. So we can do this through various skills. One of the skills we might use is Dr. Amador's resource from the LEAP program, which is I'm not sick, I don't need help. And we learn in that how to talk to our loved ones about important things when they're unreasonable from our point of view. I mean, from our point of view, actually, the solution is usually very simple. Take your medication, go to your programs, eat well, put yourself on a schedule so you know when you're eating and you're eating healthy and you're sleeping at regular time intervals and you're moving to learning about your illness and how to manage it more effectively. Yeah, that's the solution, but that's our solution. That's not necessarily theirs. Recently, I worked with a family where the siblings were very concerned about their brother, and their brother has a serious mental illness, lives alone, likes to fix stuff, doesn't necessarily want to interact with other people, cannot hold a job. His hygiene is very poor. Actually, his self-care, he cannot take care of himself independently. If he gets support from the family, they provide him meals, etc., he does okay. Their solution is he just needs to get medication, get into a program, get out, meet people. He deserves a better quality of life. I challenge their thinking only because his quality of life is what he has determined works best for him. Nobody is making him stay in his apartment. He does come out to family events, but he doesn't stay. What he does is he shows up, takes a meal, leaves, comes back when everybody's gone and it's just his siblings or just his parents. This is what he has determined is best for him. And by the way, he is medication compliant. We might want something very much for our loved ones that doesn't fit with their experience of what they want or need for their lives. It's not our job to repair that for them or to boss them around or to tell them. It's only our job to support them in what is most likely to be the most effective way for them to move forward in their lives, whatever that's going to look like for them. I love using the work by Byron Katie. Byron Katie developed this when she had an epiphany after years of depression. And basically it's 4 questions. And we ask ourselves when we start to think about how guilty we may feel, like if only I knew my family history better and decided not to have a child, okay? If only. Is this true? Yes or no? Well, not really. Can you absolutely know that it's true? No, I can't absolutely know that it's true because you may have other children who aren't compromised, who don't have a mental illness, who are functioning just fine and have joyful, happy lives and require minimum support from you other than the more typical road that parents and adult children, siblings, children and parents may take, whatever the relationship is. So how do you react? What happens when you believe that thought? I would feel very sad. I would feel very lost. I would feel hopeless. I would feel helpless. But who would you be without that thought? I would be a more loving, compassionate, forgiving person. So turn the thought around. What would happen if I didn't have a child? What would happen to me? Well, that would hurt me because I've always wanted to have a child. I love having somebody in my life that expands me in ways that I may not grow. What would happen to them? Well, it would be very hurtful for them to think that I didn't want them because they're not well. It could be cancer that they have, or they could have had diabetes, or any other illness. Would I reject them for that? Of course not. And I wouldn't have the same kind of thoughts or feelings. So this is an exercise of clarification. This is an exercise of growth. And what if we thought, okay, what if they didn't have this mental illness? What if they didn't have this chronic illness? Well, I don't know. Life would take a different turn. I would have a different learning curve. I would be on a different path. I would be on a different journey. And there might be times when, like now, there's pain, but there's also joy. And that's how you work with the work. The other part of the work is what we call the Judge Your Neighbor worksheet, and this is where you want to tell somebody what to do and why, and then we go back to the 4 questions. Byron Katie has created this, and it is absolutely brilliant, and I encourage you to go to her website, thework.com, and engage in the exercises. This is an excerpt from a program I developed years ago, but basically we called it the 12 Steps to Healthy Parenting, and it was turned out to be a parenting program for parents in recovery from substance use disorder. And very often they were diagnosed with depression, anxiety, bipolar, etc. After they became sober. So they needed a blueprint for how to parent more effectively. And so some of this material comes from there. But we look at how we are powerless over the outcome of all events involving us. We don't know where this road is going to go. So we can only enjoy the journey, so to speak, and just take one step at a time and learn as much as we can and be mindful. We are also powerless over the lives of our friends and family members. We are not powerless, however, over our own attitudes, our own behavior, our own self-image, our own determination, our own commitment to life, and the simple program of staying in the here and the now and being mindful. You are in charge of where your thoughts go. You are in charge of your mind. You are responsible in that sense for how you consider your approach to the world. That's all you can change. And frankly, you're only in charge of all of that on your good days. On your not so good days, when you're tired, when you're hungry, when you're feeling beaten down, if you can acknowledge that, then you can become more responsible and respectful for yourself. Maybe you need a break. Maybe you need respite. Maybe you need to take a time out, in which case honor yourself and do that without guilt. Because the best way to take care of others and to be supportive of others and to be present of others is to be there for yourself first. As we like to say, put the oxygen mask on you and then on others, just like they say in the airlines. The only thing we really own in this life is our attitude and our time. What you do with your time and your attitude are your only real choices. No one can take them away from you, no matter how hard you try to surrender them. Nothing is anybody else's fault. Nothing is anybody else's responsibility. You are responsible for you. If you feel that someone has taken some of your time or imposed an attitude on you, then you need to look at that. Children also need their time to be their own. Frankly, our loved ones need their time and their space. Maybe you're a trigger. Very often, caregivers are triggers for their loved ones. We tend to initiate in them a sense of guilt. a sense of shame. And it has nothing to do with us. It has to do with their own level of awareness about their illness, how well or how poorly they're managing it, how well or how poorly they're managing their medications, if their medications are even effective, because very often it takes a cocktail and it takes a lot of mixing up of ingredients in order to find what's going to work. So we need to let them figure it out with support without enabling. We want to empower, we don't want to enable. So, what in fact are we responsible for? What does your sense of responsibility look like? What I often say to people when I'm coaching them is make a list of the responsibilities that you take on to help your loved one with healing. And by the way, this is also a handout on the webpage. And if you have the book, Replanning Lives by Nancy Pizzo-Boucher, it's on page 119. And by the way, that is a wonderful resource. This is what this is all based on. It started with her work. So Replanning Lives Uprooted by Mental Illness, a workbook for parents and caregivers. So you make a list of responsibility. Are you cooking? Are you cleaning? Are you doing their laundry? Are you cleaning up their mess? Are you taking them to appointments? Are you keeping track of their appointments? Are you bringing them meals? Are you calling them? Are you paying for their phone bill? Are you the one in touch with their doctors? What does your sense of responsibility look like? How much responsibility does your loved one take on to help towards their own healing? A little, some, more than you do, less than you do? Start with that. And then again from the workbook, and the handout is on the website, make a list of the responsibilities that your loved one takes to help with their own healing. Do they have support? Have they used the health card system that's developed by Julie A. Fast, which even though she originally developed it for bipolar disorder, can frankly be used for any mental health issue and any mental illness? Are they complying with their medication? Are they showing up for their doctor's appointments? Are they taking care of that on their own, or are they getting help with that? Are you the one that's doing that? Have they filled out a RAP? RAP is Wellness Recovery Action Plan. Do they have an emergency plan? Have they helped you develop one? Are they sticking to it? Are you all following the protocols? Have they participated in developing those protocols? Life is unmanageable whenever we lose perspective about what is and what is not our responsibility. If we lose our perspective, we take offense at actions that have nothing to do with us, or we intervene when it's not appropriate, and we neglect our legitimate obligations to ourselves and others. Sometimes we have to let our loved ones experience the consequences of their poor choices in order for them to have a better understanding of what's going to be better for them, what's going to be more effective, what's going to work better for them. If we don't let them become responsible for their own decisions, how the heck are they ever going to become responsible for their own decisions? Unless life and limb is at risk, let them fall. Let them experience the consequences of their choices. And if life and limb is at risk, use your safety plan. Get your mental health community and supports activated. Our misplaced concern for others becomes intrusive, meddling, resented, and doomed to failure. Instead of helping those we care about, we demonstrate a lack of respect for them and create discord in our relationships. What's yours? What's not yours? What do you have control over? What don't you have control over? It's very, very, very important for your relationships, especially moving forward, to understand what this looks like. Let them experience the full brunt of the consequences of their choices so that they can make better decisions about what to do. Don't confuse love with interference. We don't know how to show affection or support without giving advice, seeking to sway another's decisions, or trying to get those we love to do what we think will bring them happiness. That's not love. That's interference. That's not caring. That's control. Allow our loved ones the dignity of being themselves. We don't have to like it. We don't have to agree with it. But we have to respect their right to live their lives to the best of their abilities. Be the pillow. Be the ones that can support them when they fall or support them when they need assistance, especially when they ask for it. And if they need you to intervene because what they're doing does affect life or limb, then do so. That's not being intrusive. That's being loving and caring because you want them to survive this particular episode of their illness. However, otherwise let it be. Like the daughter, like the sibling who wanted a different kind of life for her brother than he wanted for himself. And they fought about it. And she was coming from a loving place. However, she was also being very disrespectful to him. He was very clear. This is what I like to do. I like to fix stuff. I find it, I fix it, I collect it. It became a safety issue because of the clutter it was taking up in his apartment. So we looked at ways maybe he could donate to causes that would be of interest to him. And actually, when she floated that idea to him, he was more than happy to relinquish some of the TVs and radios and other technology devices that he was fixing and repairing because they were going to a good cause. So this met her need, this met his need, and it met the need of some place in the community at large. What was even better about it is that it got him to feel valued, that he was respected, that nobody was criticizing his lifestyle, which frankly is very isolated, very lonely, but he's happy in it. It actually fits what his mental health needs in order for him to be successful and to thrive. Again, I refer you to the work by Byron Katie. And what level of responsibility do you want to take in supporting your loved ones? One of the things that I do, and I have found it very successful, especially when some of my loved ones are very symptomatic and they're dual diagnosed, so I always get concerned about cash because if I give them cash, they're likely to use it on their substance of choice. So instead, I'll use gift cards. Now, granted, they could still sell the gift cards and get cash. Nonetheless, I'm not enabling it, but I am providing for them. So I will give a gift card to the supermarket so they could buy food. I'll give a gift card to a couple of restaurants so they could go out for dinner. Gift cards typically don't cover the cost of liquor. I use the book, I Am Not Sick, I Don't Need Help, because it's a very good reminder for me at this stage, but it's an excellent resource for how to have some of those difficult conversations in the most compassionate and loving and respectful way. I've done a family wrap. I often recommend families do this because it gives the family a sense of how to manage when the holidays come, when their loved ones are difficult, to continue with their own lives, to look at maybe some of the contingencies that they need to have in place. Social Security is, you might become a payee rep. If you become a payee rep, you're responsible for making sure they have a roof over their head and food and medical costs covered. As I mentioned, Replanting Lives Uprooted by Mental Illness, the practical guide for families. This is a phenomenal resource, and it is the one that we use extensively. And this particular program, Guilt and Responsibility, is from one of the modules in that resource. 5 Wishes. 5 Wishes is a living will and healthcare proxy document all rolled up into one. Frankly, everybody should have one, but especially those of us who have loved ones with mental illnesses where suicidal behavior is a symptom of their illness. This will make it very clear to you as their caregiver and healthcare proxy exactly what they want so you can honor their wishes to the best of your ability. So these are some of the levels of responsibility that family members have taken on. You'll notice I put right in the middle what is not my responsibility. And a lot of this other people's words, other people's mistakes, other people's beliefs, the consequences of other people's actions. You're not responsible for any of that. That's all on other people, other people's actions and other people's ideas. What is your responsibility are your words, my behavior, my action, my efforts, my mistakes, my ideas, and the consequences of my actions. If I can remember to keep the focus on me, to put the oxygen mask on me first, I can basically eliminate the guilt and assess what I do need to be responsible for and what I don't need to be responsible for. If a family's way of dealing with mental illness is not in the best interest of all its members, then it is not the best solution. No family need be held captive by the behavior of one individual in that family. That's an imbalance, and that puts a tremendous amount of responsibility on and off each other's shoulders. That is not the way a healthy family operates. The way a healthy family operates is we recognize that we have a loved one with a chronic illness and that we have to manage that piece of it, but it doesn't mean that we don't do holidays. It doesn't mean we don't honor celebrations or have weddings or whatever. It doesn't mean that dinner time conversation is stopped because of the individual with the chronic illness. We don't do that. What we do is we find a way to integrate. We find a way to include. We find a way to manage and move forward as a family. We may not be taking a straight course, but hey, the more hilly the course, the more interesting it is. So in this webinar, we've talked about guilt and its impact on the family, in particular the caregiver, who is responsible for what, and strategies for managing when guilt and responsibility undermine the family. If you would like more information on Grow a Strong Family, visit us online at growastrongfamily.org. You can always email us at growastrongfamilyinc@outlook.com, or you can call us at 781-405-8376. As always, take what you like and leave the rest.